Welcome to Jointly Speaking. I'm Bob Colley, your host, and I'm so glad to be here today. And it's a lovely day out finally in my area. I hope you're having a great day in your area. Well, it is my pleasure now to introduce Allen Crema, a clinical psychologist. So, Alan, welcome to the show.
Thank you very much. Pleasure to be here.
And tell me about yourself. You're a
Well,
little bit, your background or your
background,
practice.
sat educationally. I have a bachelor's degree in management from Babson College,
Wonderful.
and then I went to graduate school at Suffolk University for adult counseling.
Oh,
And there I also took courses in psychometric testing because I was very interested in that aspect of the clinical field.
yeah.
And then I finished doing my doctorate work at Boston University,
Oh,
and
yes.
I graduated with a doctorate degree. And my dissertation was on motivation.
Oh, very
I was
good.
always interested in why people are motivated to do things or not do things.
Oh, don't ever ask me, please, because
Yeah.
I have no answer.
And then I went into consulting and in human resources, which I focused on organizational development, restructuring companies.
Oh,
I did
interesting.
also a lot of work in mental health, dealing with mental health disorders and substance abuse. And I taught at Harvard University from, let's see, it was, we're going back.
Don't go back too far.
I won't go back too far, to my age. That was 1981
Oh,
to
very good.
2002.
That's wonderful.
And while I was there, I also established a consulting firm, Crema International, and I was providing mainly services to corporations and organizations, both domestically and internationally,
Yeah,
in human resources.
right. Now tell me, did you, as you got into all this and after you graduated and did everything, did you have clients that
Oh,
came?
yes.
I mean, did you have appointments? I'm not quite sure where you said.
No, I had clients in my private practice.
Yeah,
I saw people that have mental health disorders.
that must have been very
Addictions.
interesting.
Yes. And I also had clients similarly in corporations, organizations,
Oh, very
upper
good.
management. And that was a different side of the picture because there, the emphasis was on productivity and bottom
Okay.
line profitability,
Oh, yes.
as compared to in the clinical area in private practice, I was concerned with treatment.
Yeah, which that I can understand. I mean, I think that's the bottom line on
That's the
private
bottom line.
practice.
You did treatment in
Yeah.
either case.
Right,
One though was for business,
yeah,
and one was for personal
yeah.
achievement.
Yeah. Did you, in the personal, that must have been very rewarding in seeing the progress, the improvement, whatever, you know.
It was really rewarding. It was also very educational in that I was learning a great deal more about human behavior.
Really?
Yes, but I worked with all types of clients. I had people that were at state hospitals in what I call the back wards for 22
yeah.
years
Yeah.
in the state hospitals. It's a pretty rough system.
I would
And-
think that would be a very rough system.
It is a rough system because in mental health, it's very limited resources.
That's what I've been told
Yes.
and been learning about.
Yeah.
You know.
And the way it was treated in primarily the state hospitals and in a lot of sectors was through the medication model.
Has any of that been improved through the state hospitals today, or?
There's there's less state hospitals.
Well,
There's
yeah.
late, there's definitely
That's what amazes
little
me.
resources now.
Yeah.
You know, and most of it now is done through nonprofits or profit organizations where they do a lot of telehealth. Telehealth is talking over your smartphone, and there's a visual picture of you and the therapist.
Oh.
And you talk back and forth like you and I are talking right here,
Yeah.
face to face. So that's what the latest trend is,
Oh.
because it's according to the health providers, that's what the money allows them to do.
Yeah.
It's,
I do-
you don't have an hour to talk to somebody.
Yeah, I do.
You have 15,
I do
20
remember
minutes.
growing up in Danvers, and there was a mental hospital.
Right, Danvers
up
State
there.
Hospital. Yeah,
Yep, and that was a biggie. It was up
that
on
was a
Route-
big hospital.
It was big.
Yeah.
I remember that.
Yeah. The big hospitals like Danvers, and they had one in Worcester, they had one in Waltham, and across the state. They were very old hospitals. It started in right after the Civil War, a lot of these
Really?
places. Yeah. The philosophy in those days were take somebody that is having emotional problems and take them out into the country. It's quiet out in the country.
Yeah.
They have
true.
farms.
Yeah.
They have chickens. They have cows.
Yeah.
You know, let people not be stressed out
Yeah. Yeah.
by all the
And I
social
can understand
environment.
that. I really can. I can see where that would maybe for some people work.
It did work. It was very, very helpful. I
Yeah.
mean, it was far better than being able to be in a hospital setting where you had literally dozens and dozens of people in a ward. A ward could be any size area,
Yeah.
and people just sitting there or walking around. Unfortunately, a lot of people had a lot of very disturbing mental health issues, and there was a lot of chaos at times in those places.
What do, you were saying that a lot of the hospitals have disappeared, and I do agree on that. What do the doctors do for the people today if they don't have a place where they can be secure and be safe?
Well, they had the community philosophy that they would have homes for people to go to. In other
Oh.
words, they would live in homes
Yeah.
and during the day go to the hospital for daycare or for therapy or for medication.
Oh, really?
But they would try to put people into apartments where they could live independently. And sometimes it worked. And they would have supervision there. There would be counselors there to help them. They would have access to nurses.
Yeah.
But the whole idea was we don't want people on the street.
Yeah. That would be the big.
That would be a big problem for
Yeah.
society, people having their mental problems
Yeah.
out in the open. So they tried to put people into, like I say, homes.
Yeah. How do you? This is going to sound ridiculous, probably, but how do you know when a person needs help? If I was walking and talking with a person, how would I know if they needed help? I mean, I really wouldn't know how to approach it. I mean, sometimes people say things to me, and I say, "Oh, you're crazy," but you know,
Well, sometimes people can acknowledge they need help. They say it. Once they say it, they start talking, and then you really know.
yeah, true.
What the
That,
issues
yeah,
are.
that I can understand.
There are a lot of people that are walking around, I'm going to use the word muttering to themselves, are doing bizarre behavior with their hands, or doing things that would not be normal on the street.
Oh, I see. Okay.
They'd be talking to themselves.
Yeah, that
A lot
would
of
be
people
a biggie.
talk to themselves.
Yes. Gee, remind me not to talk to myself anymore.
Well, I think we all talk to ourselves at times. That can be healthy.
Yeah.
We're brainstorming.
I was saying in my room, I talk to myself all the time.
A lot of it depends on what you're talking about.
Well, true. Yeah,
You
that's
know,
probably true.
But so that is basically it. People, and then there's the other people that are homeless, that you could see that they are having mental health issues.
Yeah.
Whether it's drugs, they're mostly depressed. You don't know why they're depressed, and they're usually not taking medication, or they've had an experience with medication that hasn't turned out well.
Oh.
A lot of side effects to
Oh, yeah,
medications.
yeah, meds are wicked.
It's we could talk about that. That's a big issue in
Yeah,
itself.
it sure is.
And they they don't want to be put into a home or put into a situation where they're not free. They feel more free. They feel more independent being out on the street.
Really?
Yeah.
That's interesting. I never thought of it that way.
Yeah. A lot of people feel very, when you put someone in a confined area,
Yeah.
they get claustrophobic,
True, true.
okay? And
Yeah,
they feel
true.
the tension building up, like I'm out of control.
Yeah,
I'm out of control. I can't go wherever I want.
yeah.
I can't get a cup of coffee. Or I can't panhandle,
Oh, that's true, yeah. That's really a hard thing. I mean, I would never be able to tell whether a person needs help or not. I think
Well,
I'm
by
too
training-
easy. I'm too easygoing.
Yeah, by training,
You have to have that training.
yeah, the training significantly helps.
Oh yeah,
Yeah.
yeah.
But you could do some very good things with people that are living in the street.
Yeah.
It really comes down with a therapist, the therapeutic relationship, or just a relationship, one person to another. You can tell when someone, a clinician, is interested in your personal problems. You can feel that.
Yeah, I assume you probably can.
Yeah.
You know.
Yeah, you can feel it. It's a trust issue.
Yeah.
Can I trust this person who I've never met before?
True.
They seem calm. They seem very level-headed. They say things that make sense. And over a period of time, that grows to the
Yeah.
point that I
You
feel
build on that too.
I feel comfortable with that person talking
Yeah.
to.
That's true. I never thought about it that way, but
You're not going to go up to a stranger
oh no,
who doesn't know exactly how to, shall we say, reach you.
true. But
Uh,
I
they-
think it's very hard to. You can't bring up the conversation either with somebody because you don't know them maybe well
Of
enough
course.
or know what they've been through.
Or they could say something that's even going to make you feel worse.
Yes, that's true. That's I think more what I would worry about.
Yeah.
I don't want to feel bad for people.
You don't want to feel bad after
No.
having spoken to a person.
No,
You're
no.
talking about very intimate feelings,
Yeah.
feelings that you've experienced over life or over a
It's
situation.
it's like here. Any chance I see anybody go by me when I'm out in the hallways, right? I would say hi, and they sometimes they don't answer me, but I don't care. I figure I've said hello to them, and so that makes my day. Makes me feel good.
It makes you feel good. The
Yeah.
other thing is, the person you're saying hi to, they appreciate that,
I hope so.
and slowly they can come up to you and start talking.
Yeah,
Uh,
that's probably true. Yeah, I never
Yeah.
thought of it that way.
yeah. I mean, I've experienced things where people, in places that I've worked or lived, start off with a hello, a nod,
Yeah.
how you doing? And then all of a sudden, they'll come over and start talking to me. And that could be after 3 months.
Wow. Yeah, that's true. That's
And
true.
they exchange names,
Yeah.
and now you have a relationship. It's a relationship of knowing somebody on a very superficial level, but it's a kind relationship. You know that person is nice.
This is going to probably sound weird, but how would you work? Have you worked with? I'm not saying this right. With younger children, like say 10 years, 12,
Yes,
15.
in my career I was a school psychologist
Oh, okay.
and a guidance counselor
Yeah.
to a junior high school and a senior high school.
Yeah.
And I've even established an at-risk school for people that quit in high school because of, or even junior high, because they were having emotional problems in school
Yeah.
and the schools didn't know how to handle it
No, they wouldn't. I wouldn't think.
and they quit. Okay? So we developed a school to bring those people back in, get them a GED degree or high school diploma.
Wonderful.
And a very important part of that component was getting them on-the-job training so that they would have a skill when they finish high school, be able to go out and get a job.
Wow.
And there are an awful lot of agencies out there for people, for young people that have gone through what I've just said,
Yeah.
as well as people that were working that had mental health illness and they were, shall we say, out of the workforce.
What type of agencies are
The-
we looking at for them?
The best one is Mass Rehab.
Oh, okay.
Mass Rehab is an agency funded by the state of Massachusetts. And basically, they have two programs there. One is for education, and the second one is for obtaining work. So you have two tracks.
Very good.
And what's really nice about it is that you have counseling. They give you opportunities of going to classes to learn how to get a job,
Oh,
to talk to people, okay?
Yeah.
How to make out a resume or a single sheet of paper that tells who you are and what you've done.
yeah.
It's very difficult for people that have not been able to secure work on a long-term basis and have that gap
Oh, yes, I can
to
imagine.
go to interview and to get a position.
Yeah.
The nice thing about the Mass Rehab position is that the state, after you finish the program, the state will help you get a job and
Oh.
pay the employer to take you on as a employee.
Really?
So the state is paying the company,
I had
which
no
wants
idea.
to be part of the community, mental health, help people get back into the workforce. But they pay the company hourly rates to take that person aboard.
I never knew that.
Yeah, and the company on the other hand, they supply a counselor to work with that person to deal with any issues that they're having in the workplace, whether it's a personal issue,
Oh, yeah.
whether it's a difficult issue with the job,
Right.
learning how to do the work. They have a person that works with you.
Wow.
And then after a period of time, 6 months, 8 months, the state stops
Right,
their funding, and the company hopefully will find a position somewhere in the company
For the
to work. Now, there's a lot of very entry-level positions that people can go into. They can go into hospitality, which would be like the canteen side or the restaurant side of the
Yeah.
business. There's plenty of jobs there where you learn on-the-job training.
Right.
You could do custodial work.
Yeah.
You could. There's just a variety of things that people can do
Yeah.
that they train you for.
That's amazing.
It's a great program.
That sounds like a wonderful
And it's a wonderful program. Very simply, you go down there, you register. You have to be 21 years of age.
Oh, there is an age limit on it.
Well, you gotta, yeah.
Yeah, well,
21.
you'd have to be over 18 to go to work and
Right,
everything.
right.
Yeah, that's true.
Yeah. And then there are other programs that fill that gap between 16 and 21. Okay?
Oh, yes.
There's
I'm
a lot
sure.
of agencies
Yeah.
that have a similar type of program, and then you graduate up to maybe something like a Mass Rehab, or you go off on your own.
Yeah.
People can get help. They can get counseling. They can get support. And when the state is paying
Yeah. Who's going to
for
say
you
no?
to get work, and the
Yeah.
company is opening up an opportunity for you to get
Right.
work, it's a good deal.
Oh, yes. By all means.
It's also very cost effective for the state. You're not paying a person, you're not paying out money for someone to be in a hospital or one of these homes
Oh, that's true.
because these people are making money.
Yeah, that's right.
So it's a good,
They're out working
they're out
instead of being
working.
in the
It's a
hospital.
win-win. The most important thing, it builds up someone's self-esteem. I can do
Oh,
something.
yes, yes.
I can do something.
I agree with that because I know from my own experience of just being disabled. I could walk and everything and do things, but I couldn't work. Nobody would hire me because of my situation.
Absolutely. There's discrimination
Yeah.
against people
Well,
that
I had
have
had a lot
physical
of surgeries,
disabilities.
yeah.
Absolutely. Now, the other thing is, for people with physical disabilities, there are state agencies that just deal with disabilities,
Really?
physical
Boy, I didn't know
disabilities.
that. What I
They
did,
have agencies that
I
deal with
worked for
that.
an insurance company for 20 years. I never got paid, but I raised money for them. I did charity work for all, everything I could. I
Yeah.
raised money, and I loved it. I still want to do it here.
The other thing is, a lot of people aren't aware of this that have mental illness. There is a government program called the American Disabilities Act,
Yeah.
and it involves discrimination across the board.
Oh, yes, yes, I do.
It-
I
it-
know a little about it, but
yeah.
not much.
It's a great program
Yes.
because it protects everybody that has disabilities,
Yeah.
mental illness, a combination of mental illness and disabilities,
Yeah, true.
hard of hearing,
Yeah.
people who have poor eyesight.
All right. Yeah, I was
There,
just gonna
there are
say
there
that.
are opportunities that the federal government has. People don't know about this. One of the big problems that I've noticed with a lot of, I'm going to say, community help agencies, is that most people that are taking advantage, are trying to take advantage of those programs, really could use help from what they call a case manager.
Oh,
A case manager is an agent from some nonprofit
right.
that works with you in helping you with life skills.
Yes, true.
Okay? They deal with.
I think that's very important.
It's very important
Yeah.
because getting a bank account, a checking account.
Oh, God, yes.
How do you get a checking account?
Yeah.
How do you keep track of a checking
Yeah.
account? How do you budget?
Yep.
Okay? They do those things.
Oh, that's great.
And they're available, like with Mass Health.
Right.
A lot of people in the state are on Mass Health, or another program that's similar to Mass Health, which is Commonwealth Health Care.
Yeah. The one
Okay.
thing I hear a lot,
Commonwealth Health Alliance.
every time somebody talks to me about health, they always say, oh, Mass Health. And that's all they ever say. That doesn't tell me anything.
No.
I don't know what they're referring
Well,
to.
like Mass Health, people ask a lot of people that are at this level if they have Mass Health.
Yeah.
Most people have it, but what they don't realize that Mass Health has like 80 different programs.
Yeah, and that's what I mean.
It's
I
not
didn't know.
It's not just Mass Health.
But see, that's all I knew it was. I just thought it was from
Everybody
what people
thinks
had said.
that.
Yeah.
There's a difference between Medicaid and Mass Health
Wow.
and Medicare.
Whoa.
There's 3 different programs,
Holy mackerel.
and you could have all 3 of those programs
Yeah.
if you are able to do the paperwork. Now, the paperwork is a big problem.
Oh, I can imagine.
It's overwhelming for somebody that has all these emotional issues. You have a case manager that sits down with you, gets the information, puts it on paper, sends it in to Mass Health or Community, the Alliance,
Yeah.
Community Alliance, or to Medicare. For example, you get onto Mass Health, okay? Then there's long-term Mass Health. And then there's Mass Health for elderly for long-term placement in a
Facility.
assisted living
Yeah.
or a nursing home.
Yeah.
I mean, people are going to end up in some type of a retirement home, assisted living,
Yeah.
eventually a nursing home.
Boy.
And then you have the things with the illnesses, like cancer,
Yeah.
and you have the hospice
Oh,
program.
yes, yes.
A lot of people just don't know all about that.
Yeah.
I mean, the most famous and best program for cancer is the Dana-Farber Clinic
Really?
in Boston, which is
Oh.
part of Mass General and part of the Brigham.
Yeah.
You can go there and pay nothing.
Wow.
People come from all over the world,
Really?
paying literally
See, I didn't even know
thousands and
about it.
thousands of dollars.
Wow. I've been
And-
very lucky. I've had a very healthy family.
Yeah,
And that's in any sense. I mean, both my mother and father took a nap and went to sleep, and that was it.
yeah.
I mean, they were never sick
But cancer-
beforehand or anything.
Cancer is very prevalent
Yes,
in this
it
day and
is.
age.
I've
And
noticed it
they don't.
today.
The
Yeah.
studies about food
Yeah,
and the artificial flavorings that they put in,
yeah,
the chemicals they put in,
yeah.
natural flavoring, all all because people want to taste and feel good.
Well, true. I like.
And
I,
everybody likes
yeah,
that.
I want my food to taste good. I
Yeah,
admit it.
but
you
the
know.
question is, if you're taking chemicals that can cause cancer, that's in that food,
Yeah, true.
you have to be careful.
Yeah.
You have to know what to pick and choose.
Yeah.
Anyways, there are.
But how do you, but see now, as an average person, how would you find or know how to decide those foods? Like, I mean, I don't know.
There
I'll
are
be honest with
there are
you.
nutritionists. There's dietitians. You go down to a place like UMass.
Yeah.
UMass has nutritionists. They have dietitians.
Yeah.
Okay,
Yeah.
and you sign up for one of those people. If you have Mass Health, any Mass Health program, that pays for it.
Oh, okay.
Doesn't cost you a penny.
Huh.
That pays for it, and that way you find out what you should be doing.
I'm
know,
sure
that's
they're
best in
going to
your
tell
health.
me I have the worst diet of anybody.
A lot of people have the worst
Oh.
diet. Obesity is a big problem
Yeah, you
in
know,
this country.
that's one thing I tell anybody I see anywhere. If they're older, and I have an older woman, not very old, but she's in her 50s, and she told me last week she's on a diet. And I said, that's wonderful. She isn't really heavy, but she's got a little extra weight. And I said, you know, you're doing yourself a favor.
Absolutely.
Because when you get 65 and you get sick, you've got real problems. And I said, you're better off to take the weight off now while you can.
You don't want to have to deal with these issues
Yes.
in your 70s, 80s, and
Yeah.
90s.
Yeah.
You don't want to have to deal with an operation.
No, that's,
Oh,
I
and
know,
one thing-
I've told many people
Right.
that.
And one thing you don't want to deal with is falling down.
Oh, God, no.
God, you fall down when you are older,
Yeah,
the bones are more brittle,
yowza.
you can injure yourself
Yeah,
to the point that all of a sudden you have to use a walker
yeah,
or you have to use a wheelchair.
right,
And that's it.
yeah,
So the things that you could do are no longer able
yeah.
to be part of that.
Yeah, the only reason I have to use a wheelchair is because my right shoulder has become, I have an implant in it.
Yeah.
And it's a year and a half. And they won't operate, so I can't walk with a walker because I can't hold the
You can't
walker.
hold both hands. You
I
can't hold
can't
both. Yeah.
But I'm trying. I've been practicing with my nurse. She gets very
Physical
nervous.
therapy, physical therapy, and occupational therapy can help strengthen certain conditions in the arm and shoulder.
You think so?
Some can.
Okay.
Depends on.
I never thought of looking at them because I figured they can't do anything. It's loose. I mean, I move in a certain way and I feel it. I'm very careful with it.
I have 4 torn rotocuffs, complete
Ooh.
torn rotocuffs.
Gee, join the
I
crowd.
was going to. I tripped in a parking lot,
Oh, God.
and I have. It's a condition I have. I can move my arm a certain way.
Yeah.
Okay. I also had a shoulder replacement.
Yeah.
That's
what I have.
An artificial plate
Yeah.
in the shoulder blade
Oh,
where I can, where the socket is,
yeah.
and that works miracles.
Yeah. Mine goes all the way down the arm, my
Yeah.
implant. I have
Yeah.
a total implant.
But physical therapy
Yeah.
is something that can help significantly. It might not treat everything. There might be limitations, especially if they can't operate.
Yeah. You know what they said to me? They said I'm too old. I'm bull
Yes.
crap. I'm not too old.
No, what they mean, what they mean is that there could be a danger from other medical conditions you have.
Oh, okay.
Okay.
That makes
Yeah.
more sense.
That
yeah.
makes more sense.
Yeah.
It's not that you're that old. It's not that your age is preventing that.
Yeah.
But there are complications when
Yeah.
everything is connected.
Oh, yes.
Okay, you have a
Tell
problem.
me about it.
Yeah, you have a problem. I mean, many alcoholics have problems with their liver or their
Oh,
kidney.
yeah, yeah,
Okay,
true,
Now,
yeah.
liver and kidney are not things you fool around with, because that's where all the blood is circulated and goes to other parts of the body.
Yeah.
So
right.
if you're having a problem there, you're having a problem throughout your body. So there are certain things that are questionable to do
Yeah.
because you could have worse problems than you have if you didn't have the,
Oh,
the
yeah.
surgery.
No, I mean, I've got the rheumatoid, and I've had it for 40 odd,
Yep.
50, 60 odd years, I think, since I
Mhm.
was 21.
Yeah.
And I'm used to it. One thing I don't do is I don't take pain medication, and that drives everybody crazy. But I said I've learned to accept the fact that I'm afraid if I take the pain medication, this is the way I look at it. If I take the pain medication and I have to have surgery, then the surgery afterwards, the pain medication they give me might not work as well because I'm so immune to the system. I don't know if that's true or it's my mind, but I worry about that.
Well,
so
there's
I don't,
a lot
but
of
I'm,
there's a lot of new things
Yeah.
regarding pain.
But you'd be surprised at how good I am with the pain.
Oh, you've learned how to deal with
I've
it.
learned how to deal with it, and I just keep on trucking.
But there's a lot of new things that are used to relieve pain that aren't medicine.
Oh,
For example, they have medicated pain patches.
pain pad. I
you
don't
know,
know about that.
Well, have you ever heard of the people that smoke? They have
Yeah.
those smoking patches.
Yes.
Same thing. Okay.
Oh, for God's
Yes.
sakes.
And you put these patches on the area
Yeah.
that is painful, and that will significantly reduce the pain for probably about 10 to 12 hours. Then you put another patch on.
Yeah.
So you have 24-hour patches,
Wow.
medication that is going into the skin
Yeah.
and relieving the pain. So you're not taking a pill.
Yeah, that's what I don't like. See,
Well,
I don't
the
like
pro-
taking meds.
The big problem with medicine these days are
The side effects.
side effects, the drug interaction.
Yes. True.
When you take these strong medicines, like on television, they have all these new drugs that come out. They spend 10 seconds describing this particular medication takes care of this issue. And then underneath, they have in print for the next 25 seconds of the 30-second commercial telling you all the side effects.
Oh, great.
Right?
Yes.
So,
that's true.
you could
I
take
never
it
thought
and
about
take,
it, you're
this
right.
is going to be okay, but
Yeah.
you know what? I have several of these other side effects,
Yeah. Of
okay?
course.
So, I don't need that.
Yeah. I know. I don't like
Drug
taking.
interaction is a very complicated
Yeah.
thing.
I just don't like taking medications. I'm so afraid of them in the sense that they're gonna boggle my mind up, and I won't be able to think clearly, and won't be able to do things, do the radio show, whatever. I've done. Just,
When I was working at Harvard in the medical school, although I'm not a physician, I'm a psychologist, I learned a great deal about how medications and the best way to give medications. And sometimes the medications, I've always believed, you start out very slow.
Oh yeah.
You start out with a small dosage, and
I
you,
would believe
and
that
you
too.
work your way up.
Yeah, if you
And
have to.
If
Yeah.
if you have to, some people,
Yeah.
and especially if you have other medications
Oh yeah.
where you have the drug interaction.
Yeah.
I remember I had one client that was manic depressive, and one of the best medications for that is lithium, which is a salt
Yeah.
combination
Okay.
ingredient, and usually it's a 300 milligram tablet. That's the lowest you can do.
Ooh.
Well,
Sounds
we
nice.
started somebody out at the 300, and he was having significant side effects. So then we
That
dropped
sounds
it.
like a lot. 300.
Well, that was the smallest pill I could give.
Oh.
So then they went down. Then they cut the pill in half. They gave him 150. Then they cut it in half again, and they gave 75. Each time he had less side effects.
Right.
So the medication was working, but the side effects were there. When all was said and done, the 300 milligrams ended up being 3 milligrams. And we were able to put it in a solution. And he could take the medication with an eyedropper and measure
Really?
3 milligrams.
Wow.
And that was his dosage.
Holy
So,
mackerel.
yeah, so it did work. We saw it working.
Yeah.
The question is, what was the borderline that he had to get down
Yeah.
to not have the side effect?
And that's what I think a lot of, I notice, I've seen people in my time working and doing and traveling and seeing people. People take medication and they just take whatever the doctor tells them.
Hmm.
And whether they check it or not, I don't know. But boy, some of them are so far out there, and they shouldn't be.
Well, that's where
And
the
that
other.
scares me.
This is
but
what
yeah,
this is where the other problem comes in.
Yeah,
Doctors don't have that much time to spend with the patient to
True.
talk to them.
true.
Okay.
Yep, I agree.
And now if you get 15 minutes or 20 minutes when you see the patient, that's about all you can give because
Yeah.
that's how the structure is set up
Right.
between the insurance companies and the facilities that have the
Yeah.
doctors.
Yeah.
So they work 9 to 5, and they have patients every 20 minutes.
Yeah.
Now we're off for lunch. They don't work before 9 o'clock. They don't work after 5 o'clock.
Yeah.
That's
I know.
medicine these days.
It is. It's terrible.
Okay? So now they're bringing in nurse practitioners or physician assistants. These are people that are trained also in medications. But they don't have the in-depth understanding or courses, that you need in becoming a psychiatrist or a doctor.
Right. Yeah.
Okay.
Yeah.
And some people use certain medicines that they've worked before, but they've never had the training in that particular
Right.
medication.
Yeah.
I mean, a lot of physicians give a lot of medicines that they haven't had the background in, but they read about it, and
Study up.
and they're trying to help the patient.
Yeah.
Trying to help because the patient has nowhere to go.
Yeah. The only thing I found with a doctor, I had a surgeon in Florida whom I wish I could have packed him up and brought him with me. He was that kind of a gentleman, and he was very good. I've spent a lot of time with him, probably 20, 30 years.
Yep.
But he got to know me, and I found he would sit and talk with me when he knew I had a problem and handle it. And the last time I had surgery, he couldn't do it. And he said, I'm not going to do it, Bob.
Yeah.
I don't feel comfortable. He
Right.
said, go to Boston. I used to come up here for all my surgeries to bring them in women's.
Yeah.
Every single surgery's been done up here. But he said, I'll keep an eye on you. I'll x-ray you. I'll do whatever I have to. And he did. And this one particular time, he said, you've gone beyond what I can handle.
That's right.
And he said, you go and get up there and get it done. And that's the way he was. He was fabulous.
Is there any other way that it should be done?
No,
Right.
not in my opinion.
Right.
I mean, he was a surgeon, but he wasn't willing to just earn a couple of bucks off of me for the sake of doing a crappy surgery, as I would say. He wouldn't do the surgery, and he'd check with me every 3 to 6 months, constantly, because almost every 4 years I was up here having surgery.
Sure.
And he was wonderful, and I so respected him, and I assume he's still down there doing, but he was good.
There are doctors and nurses that are very, very good.
Oh yes, yes, there are, and that's the thing, but to find them,
That's the hard thing.
that's the hard part for all of us, I think.
I remember personally, I had a problem with my lower back for a sciatic injury, playing racquetball. I went to 8 different specialists
Ooh,
before I found one that really made sense
right,
to me, and it took that long to find that one person.
yeah, it does, it really does, I know.
And he was a surgeon in the army, and although I saw these other 7 specialists,
Yeah.
I remember going to his office. He says, "I want you to roll up your pants and take your socks off, and I want you to walk.
Oh,
I want to see how you walk."
interesting.
I took 3 steps. He says, "You can stop. I know what the problem is." Now, first of all, the other 7 people didn't even ask me to walk.
Yeah, see, that's
Didn't even
it.
ask me to walk. He says, and I had all these different orthotics,
Right.
which are inserts that
Right.
were made specifically for my feet. He says they're all wrong. They're all wrong.
Wow.
And
That's what
he,
scares me.
he ended up making a cast that I would put in my shoe or my boot, a plastic cast that was hard plastic,
Yeah.
and my foot couldn't move a centimeter
Wow.
without being
Right.
without
But
being
it was being correct.
it was being corrected
Yeah.
automatically.
See,
I
that's,
wore those things for a
Yeah.
few years till my bones were
rigid.
rigid. They moved,
Yeah,
they moved,
but they were stronger.
but I never had the problem after
Yeah,
that.
yeah. And that's what I like.
Yeah, so you have to shop around.
Oh, yes.
You have to ask questions.
Yep.
Okay?
Yeah, I agree.
And what works for one person doesn't work for another person.
Yep. No, because I know I can't, nobody in Florida wanted to operate on me because they didn't feel qualified because I've, had so many surgeries and they have to be redone and redone. And they didn't want to do it. They said they only do the original ones, they don't do the repeats. So when I first had a surgery, I came up here to Brigham
Yeah.
and started there. And they got to know me very well up there, and that's where I went. But I respected them when I went up there. They knew who I was. They had my record. They knew
The
everything.
Brigham Hospital is exceptional.
Yes, it's very good. I
very
have
good.
to say, surgery-wise,
Most of my
I've
special-
never had a problem.
yeah,
Would you
most of
believe
my
that?
specialists are at the Brigham.
Yeah, yeah, because I've had no problem. I've got them in my back, my shoulders, my hips, my feet, my knees. This shoulder is loose because the bone gave out.
That's another hospital that people can go to that are financially strapped,
Yes.
and they can work out a payment plan,
Yep.
which is token payment.
Yeah, they're pretty good there.
Token payment.
Yeah, I've never had a problem
Yeah.
financially with them.
And that's if you don't have the
Yeah,
insurance.
Yeah, yeah. But, it's so hard today for people. I've had so many people say, oh, what do I do? What do I do? I say, just find the right doctor. Find the doctor that you can get
The
information
first step is to get a healthcare manager.
Yeah,
Okay.
true.
For example, people that have Mass Health, they do not know all the benefits that
Oh,
they
I'm
have.
sure they do. Yeah.
Okay, I mean they got a transportation benefit where anywhere in the state, for medical purposes, they'll give you a ride
Yeah.
for free.
Wow.
For free.
Whew.
You go into Boston. If you went by cab, it'd be like $350.
Oh, it's ridiculous. Yeah.
And if you went by Uber, it'd probably be $100 or maybe
Yeah.
more than that. You just call up Mass Health. They have an agency that works with them.
Really?
You tell them where you want to go. You know what time your appointment is. They'll pick you up right at the door. They'll bring you back to the door.
Wow.
People don't know about that.
No, they don't. I
You
know.
know, you have-
I didn't know about
You
it.
have other insurance companies like that Commonwealth Alliance. They give $1,000 debit card to you that
Yeah.
you can use to go into CVS or Walgreens to buy
Oh, medications.
not over-the-counter medications.
Oh, over the counter.
Yeah, that's anything.
Wow.
That's diapers, toothpaste, anything. They give you $250 every 3 months, and you get that every year. Now, $1,000
That's a lot.
is a lot of money.
You better believe it.
Hey, you can get hearing aids, you can get glasses, a lot of things you can get. So all of these government agencies
Right.
have a lot of benefits. It's the same thing with, you can get a wheelchair, you can get a walker, you can
Yeah.
get canes, you can
Right.
get medical devices, you
Yeah.
can get things for your bathtub, so you're not going to fall and break a leg.
Yeah.
You know, they have all these things free,
It's amazing.
but you need to know about it. That's
Yeah,
why
and see, that's the thing. The general public
doesn't know.
Does not know.
No.
They don't hear because I think
You need to ask.
You have to ask. The hospital doesn't publish it, and I think that's. And I understand why they don't.
Yeah,
I
Mass
really do.
Rehab has one agency. It's an ombudsman. They have a phone number.
Oh,
and they tell everybody what their benefits are
yeah.
throughout the Mass Health program.
Really?
Yes.
Oh, that's interesting.
They'll even help you get a case manager. Everybody needs a case manager.
Oh, yeah.
You
Yeah,
don't know.
I really believe that. I haven't had one,
Yeah.
to be honest.
Yeah.
But after the 27 surgeries, believe me, I wish I had.
Where we're having our interview now, this retirement home has exceptional resources of 3 women
Really?
that know all about this stuff.
Oh.
And if they don't know, they know where to go.
Oh. Now, see,
All you have
I
to-
didn't know that.
All you have to do is make an appointment to go in there.
Oh, for God's sakes, I didn't know. I had no idea.
I don't think a lot of people know.
No, I know they don't because I hear them talking, at lunchtime or something, and it's amazing.
They are 3 very knowledgeable, excellent people,
Yeah.
exceptional interpersonal skills that I just love to help people.
Yeah.
All you have to do is make an appointment.
I just wish I was my mother.
You just wish what?
I was my mother. She lived to 106, and she just went to sleep for a nap and never woke up. And
My
never,
mother was 104 and she did the same thing.
and she had no problem. She
Nope.
wasn't sick.
No,
It was amazing.
no, my mother said at 104, it's
Yeah.
time for me to go.
Yeah, she didn't say anything. She said, she took a nap every afternoon, and that's the way she went. And I so admire that. It was so comfortable, and she wasn't sick. At 106, she had all her faculties. She drove me crazy.
My mother was 104. She had stents put into her kidney.
Oh,
And the doctor said to her, Mrs. Crema, I have good news and bad news.
uh-oh.
She says, well, give me the good news first. He said, the stents are successful.
Good.
You have no problem. What's the bad news? He says, they have to be replaced in 7 years.
Oh.
My mother says, well, I'm 104. We need to make an appointment today. And everybody cracked up.
Oh, of course they did.
Even my mother.
Yeah, you better believe it. I
You
would
know.
have too. Believe me.
The doctor couldn't believe it.
Yeah, but see, that's it, And I don't know. I think it's so hard for people today to go to a doctor and find a good doctor. Any ideas? We're almost done, but would you have any recommendations for people for seeing physicians, what they should look for or what they should do? Or?
Well, first of all, I try to network. See, I have contacts at Harvard. I have contacts
Yeah.
in the industry. So I have plenty of people that know
Yeah.
where to go and who to see. I'm very fortunate in that way.
Yeah.
But if you don't have that,
I didn't. I lived in Florida. We
Yeah.
didn't have that.
first thing I look for in a hospital is its rating. The rating of the hospital.
Oh, okay.
Like, if in Boston, where we're near located,
Yeah.
you have Mass General, you have the Brigham Hospital,
Yeah.
you have Beth Israel,
Oh, yes.
and
yeah.
you have the New England Baptist Hospital.
Yeah.
Those are the 4 key hospitals in Boston.
Really?
They're all good.
Oh.
They all have different specialties.
Yes, they do.
Okay, Mass General has the eye and ear clinic.
Yeah.
Beth Israel is for pediatrics.
Mhm.
Okay, Brigham and Women's heart, cancer, and delivery of children.
Yeah.
They also are affiliated with Dana-Farber, which is strictly cancer.
Mm.
And then on the 4th one, which is New England Baptist, they're noted for their injury
Oh. Yeah.
specialty.
Oh.
And that is people that have sports injuries or people that have accidents
Yeah.
and everything from the top of their head to the tip of the toes.
Yeah.
They have specialists in there that deal with a specific area of the
Yeah.
body.
What I find very depressing, and I'm hearing this from people, is that they have, say, certain insurance,
Oh, yeah,
and they can't go to a certain hospital that they
That's
like
true.
to go to.
right.
That leaves them stuck.
That's right.
And that's
Now-
not, that's, to me, that's not fair.
Well, that's why that's why there's so much controversy in Washington about health care.
Yeah, yeah.
Okay?
Yeah,
Pre-existing condition.
yes.
Well, that's a big thing,
Oh, it is.
you know.
Yeah,
And they can make a pre-existing condition, insurance agencies, to, avoid having
oh,
to
yeah,
pay.
I know.
So firstly, you have to have an insurance company that's got a good reputation. Best one in this state is Blue Cross Blue Shield.
Yeah,
Why is this so good? They insure all Massachusetts state employees.
oh, I didn't.
Everybody,
Yeah,
everybody that works for the state of Massachusetts
really?
has Blue Cross Blue Shield, which is the best.
Yeah,
Why do they have Blue Cross Blue Shield? Okay. One, it's the best. And Blue Cross Blue Shield gets a large pool of people
yes.
that
yes.
can help
Yeah,
deal with the expenses.
yeah, true.
So Blue Cross Blue, now example, they have one program, they call it a Blue Cross Blue Shield Senior Saver PPO program.
What
There
the
are two
heck is
programs.
that?
Well, there are two programs. PPO means that you can see any doctor you want.
Oh,
HMO costs a little less, but you have to find a doctor in their system
that works for you.
that is available to
Oh.
take you on,
Oh, wow.
okay? That's a big thing.
That
You might have a
is.
doctor, but can he see you?
Oh, my gosh,
Okay?
yeah,
For
that's
example,
true.
I had to make an appointment a couple days ago to see somebody, February. I said, February? Nothing sooner than that? And I had a
Gosh.
conversation with a woman. We established a relationship. She said, call your PCP. That's my general practitioner.
Yeah,
Have him call us. We'll get you in faster. A month.
you're kidding.
No, because he called.
Wow.
She says that's always the way. If you call, you go to the end of the list.
Yeah, that's probably.
If your doctor refers you,
Yeah,
you get in sooner. And if the doctor is on the staff there, if he's a Brigham physician that
Yeah.
you have that's referring you to another Brigham physician, we'll get you in faster.
wow.
Sometimes I've gotten in there within 2 days.
Whew. Yeah.
Doesn't happen. You got to know these things.
Yeah, you better believe you got, because
better
I
know
know,
these
I mean, right now, I don't have a doctor for orthopedics. They've seen me, some people have seen me and x-rayed me and they know what's wrong, but nobody's doing anything, and I'm kind of up in the air. I don't know what to do.
I'd be glad to talk to you
Yeah,
about that.
we need to talk
Yeah,
about that
because
sometime.
I know some
Yeah,
very good
'cause I'm-
surgeons at the Brigham.
Yeah,
And
well,
you've been to the
but they
Brigham.
won't let me go there.
Who won't let you go there?
Bring them.
Who? The insurance?
Well, I'll tell you about it
Okay,
afterwards.
all right.
But it's interesting what can happen, you know.
Oh,
Live and
I've heard
learn.
all those stories.
Live and learn,
No,
as
you
they
live and
say.
learn.
Well,
I
let
agree.
me tell you, this has been a pleasure.
My pleasure.
I really want to thank you for today. I have truly enjoyed it. And I love learning, so.
Yeah,
But I like to understand better what people are going through, and then I can cope with them better and understand them better,
yes.
you know, and sympathize
Well,
if
again,
necessary.
the big thing is the relationship.
Yes,
How people perceive you
yeah,
and how they perceive your background and
yeah,
what you're saying.
yeah, very
So,
true.
It's been my pleasure being here.
Well, thank you very much, and we'll talk again sometime soon.
All
Thank
right.
you very much.
My pleasure. Thanks.